so much. And thanks to all of our members who are here. I'm going to do something really dangerous and introduce them. Congresswoman Ayanna Presley is here, Norma Torres, Jan Schakowsky, Lois Frankel, and Cindy Comlisher.
Yes.
Cindy Commissioner, our new member from LA. And they're all here along with the rest of the over 160 co-sponsors of this bill. And we are all here together today to say this simple message. Access to health care, including abortion, should not depend on how you pay for your health insurance.
That's right.
Pure and simple, stop, full stop. Access to abortion care should not depend on how you get your health insurance. After the Dobbs decision, people realized that everybody in this country has the freedom to choose their full health care access, including abortion. And 20% of the women in this country of reproductive age are on Medicaid. So what does this mean? For more than 40 years, because of the Hyde Amendment, people who are on Medicaid have not been able to get the health care services that they need. Millions of people, and ironically, all of them lower income because they're on Medicaid, will have been denied access to abortion care because they couldn't pay the full cost of the procedure on their own. Justice Ginsburg used to say that the Hyde Amendment was the worst public policy that we had in the United States. And the reason is because wealthier women, people who have private insurance or even the financial means themselves, can pay for the abortion care they need. But poor women, people least able to support children that they didn't plan for, cannot get the services they need. And people have to wait for a long time to save up the money. And as we know, the longer you wait, number one, in many states, the harder it is to get this procedure now after the Dobbs decision. And number two, it's a riskier intervention if you wait long. But that's what people are having to do. 1 in 4 women on Medicaid who wanted an abortion were unable to get one because of the Hyde Amendment. And we believe after the Dobbs decision, that's even going to get worse. So we are here today to say to America, this is about people and their doctors and their families and their decisions, their freedom to make the decisions about the health care they need. We need to pass this bill. I want to thank Barbara. I've been fighting for this a long time, but Barbara's been, I'm not going to say you're older than me, but Barbara's been fighting for this a lot longer than any of the rest of us. So thank you. Thank you. And I'm going to say one more thing. The pro-choice caucus is mindful, and it did not go unnoticed to us that this week, H.R. 7, which would have codified the Hyde Amendment, was pulled from the floor. And that's because the Republican majority in Congress knows that these bills they're doing are not popular. They realized that this is not what they need and not what the American people said in November. But we are going to keep reminding them day after day, week after week, until the next election, when the American people will elect a Congress that will give them the full range of reproductive rights.
Right.
Thank you very much. Who's next?
All right.